It should be done both in full extension and in the resting position, which is about 25 to 30 degrees of knee flexion. So in the full extension position, I'm going to be applying pressure, pulling out here and pushing in here to test the ligament on the inside of your knee. Is that okay? All right. So I'm just above the knee. You could be on the outside of the knee or just above. You want a nice long lever, so I'm just above the medial malleolus here, and I'm pulling towards me with this hand and pushing in with that hand. So, any pain? So that's gonna open up this side of the joint, right? So what we're testing is the medial collateral ligament, and we're looking for pain at the attachment points of the ligament, along the ligament itself, or an excessive range of motion, or both. So in this position, you're getting the medial collateral ligament and the joint capsule, but in the resting position, I'm just gonna use my knee. So you could put a bolster like a towel or something under there. In a small leg, you might be able to just hold it up in that position. This would be fine for me, or you can put your knee underneath. If you do put your knee underneath, make sure you put a towel over your knee in an OP situation. This position of 25 to 30 degrees of knee flexion tests more of the anterior superficial fibers. And remember also, you might get a pull on the medial meniscus. So that's also a possibility for a positive, but truly it's about the medial collateral ligament. And it's usually these anterior superficial fibers that are injured first. So it's more likely you'll get a positive here. Any pain? Great. Try not to do rotation. Try to make it a nice pure movement of valgus force. For the lateral collateral ligament, we're just gonna switch our hands from here to here, okay? So again, an extension. Any pain? And any pain. Great. I would still do this unaffected side and then affected side. If they have general hypermobility or ligament laxity, then that might just be, I might say, wow, that's excessive range of motion, but that just might be that person. So I want to compare to see if I'm getting the same thing on both sides. Cool. Please distraction test.
Did you talk about the photo?
Oh yeah. We don't like this photo. In this photo, the person is standing between the person's legs. That is never appropriate, okay? So just put a big X through that. Yes.
No problem. It just, yeah, if you're gonna go back to your notes in reference, just put a big X through it and.
Because it would be bad in an OP. We would definitely lose marks.
It's a little goofy.
The Apley's distraction test is also a test for the medial and lateral collateral ligaments. It does not differentiate between which one we're testing, and you'll see why in a second. So we're relying on the patient, if they're experiencing pain, to point to where they're feeling it. So can you lie on your stomach? Again, I would do unaffected and affected side. Can you come just a little closer to the edge of the table? Again, I would put a barrier here like an imaginary towel. And then I'm gonna use my knee to pin down her thigh. I'm grabbing just above the malleoli, and I'm gonna be pulling up towards the ceiling and then rotating. So turning from in and out. The potential issues you might have, just moving the tissue and not the bone. You don't wanna grab the ankle and start torquing the ankle around, so make sure you're above the malleoli. Any pain? So internal and external rotation. And again, when I say any pain and she says yes, we really need to point to where it is. Is it in the medial side, or is it in the lateral side, or is it just that I'm grasping too hard or twisting her skin? You know what I mean? Peter tells a story, you lie on your back. He was doing a test where he had to stabilize the person's foot and ankle to do something at the knee, and they were like, "Oh yes, that hurts." And he's like, "What's wrong?" He had his keys in his pocket. And they were jamming in the person's foot. So make sure you find out where the location and the quality of the pain is.
Get off.
All right, let's try those. Try those.